What is critical thinking as it relates to nursing? Critical thinking is a skill that will be learned through experience during your active involvement in the care of patients. You will gradually learn to make sound judgments as the patient's condition changes, either as the patient improves or worsens under your care. However, you must be vigilant in your inquiry. You must keep an open mind as you face each patient care experience. Hello, this is Susan Knowles, nursing faculty from Cochise College Nursing. Welcome to this podcast where I'll be discussing critical thinking in nursing, which was adapted from Betty Ackley, RN, and author of Nursing Diagnosis Handbook, an evidence-based guide to planning care. A nursing assistant is taking a blood pressure on a surgical patient. The blood pressure is 90/60. The nursing assistant is thinking, I've got to get this recorded and get the rest of those vital signs taken. Usually thinking is routine, as in scenario 1, or aimless, with random thoughts running through our heads. Usually thinking is not purposeful in nature. Now in this scenario, the registered nurse takes a blood pressure on the same surgical patient. The blood pressure is still 90/60. However, in this scenario, the RN is thinking, is this patient hypovolemic? Is he heading into shock? What more should I assess? Can he be septic? What are the other vital signs? Pulse, respiration, temperature? Do they show a pattern? In this example, the nurse has a lot of thoughts running through his or her mind. And this is an example of critical thinking. The nurse is thinking to determine what is happening to this patient or client. The client may be in serious trouble. Critical thinking is significant. In these two scenario illustrations, the difference between regular thinking, what the nursing assistant is doing, versus critical thinking, what the nurse is thinking, this ability to think critically is key to excellent nursing practice. In fact, great nurses are virtual thinking machines, always observing, questioning, analyzing, diagnosing, evaluating, and so much more. Critical thinking is the use of those cognitive skills or strategies that increase the probability of a desirable outcome. It is purposeful, reasoned, and goal-directed. Critical thinking is purposeful and solution-seeking. Critical thinking includes identifying and challenging assumptions, challenging the importance of the context, imagining and exploring alternatives, reflective skepticism. That means seriously thinking back on what's going on with the patient and being skeptical about it, thinking what's really going on, not necessarily taking it all at face value. Making good arguments for what you think is really going on and having some creative thinking. What else could you do? The nurse's goal is not to be in a code on her client. Instead, her goal is to prevent the code from happening by anticipating changes in her client's condition. It is more than logical thinking and problem solving. As I said, ideally nurses should prevent problems from happening. Some of the characteristics of critically thinking people are those that are truth-seeking, analytical, inquisitive in nature. Critical thinking folks are self-confident, open-minded, systematic in thinking, mature and creative. Components of critical thinking are both left brain thinking, so that logical problem-solving side, and in right brain thinking, which is that creative, intuitive, as well as the side that tries to prevent problems from actually happening. Critical thinking in nursing is where it's at. It separates the professional from the technician. Enjoy using your mind. It's the most fascinating thing in the world. Critical thinking is a skill that can be taught, and it improves with practice. Expert nurses use critical thinking. Thank you for joining me on this podcast, Critical Thinking in Nursing. This is Susan Knowles from Cochise College Nursing.